Hi there, and welcome to week 2, module 2 of our course on refugee and migrant health. In week 2, we will discuss and engage in a seminar presentation as it relates to practices and experiences in working with and managing refugee and migrant populations around the world. For this particular week, we will identify and describe these very practices and experiences, compartmentalizing the globe into different geographical regions and then focusing on each region, their characteristics in terms of how they manage this issue of refugee and migrant health. From the African region, that continent has an estimated population of about 1.2 billion people. And out of that estimation, there are over 22 million persons that are considered international migrants and counting about 6.3 million persons that are refugees, 80% of which occurs within the continent of Africa itself. There's a lot of movement within the continent. Some of the preferred sites include South Africa, Cote d'Ivoire, Nigeria, as well as Uganda, where persons migrate in the interest of opportunity, as well as these sites serving as friendly towards migrant communities as well. Some of the experiences as it relates to refugees in particular in Africa has to do with forced displacement as a result of conflict, civil unrest, wars, also adverse climate, weather, environmental conditions leading to famine, loss of crops, food. People are forced to relocate. We have issues with regards to water security and safety, also serving as a challenge for persons to remain within their country or region of origin. So these drivers are forcing persons to relocate with limited opportunity to return to their home or region of origin. In South Sudan, for example, half that population is affected by the conflict, and a third of them have been displaced as a result of the civil war that's occurring. Some of the complications as a result of moving persons from one region to the next is that there is a propensity for disease outbreaks to occur, increased risk of diseases that spread, especially communicable diseases, infectious diseases. Example will be the Ebola outbreak in West Africa. Mass displacement in the Central African Republic and Congo as well have led to cases of cholera, measles, and imported cases of polio, especially in the destination countries. Children are also prone and at risk for trafficking, whether it's for forced labor, whether it's to be part of the civil unrest, as well as even in the sex trade. Some of the practices as it relates to how countries and regions within Africa manage the refugee and migrant health issue is, as in the case of Kenya, where there are national policies in terms of how they manage migrants moving into the country as well as Kenyans moving out of the country. There's tracking, there is surveillance, and there is design and development of programs towards meeting some of the needs of these communities. In Ethiopia, they are enhancing the capacity to deal with some of the social determinants: education, income, social stability, community empowerment, dealing with these determinants which create migrants and refugees to begin with. So that precautionary principle is being applied in Ethiopia with regards to hopefully reducing the likelihood of persons having adverse outcomes as a result of being refugees or migrants. In South Africa, they are empowering refugees and migrants, providing them with access to community resources, to education opportunities, job opportunities, and based on the economy of South Africa, that has preferential transferability in terms of their country or region of origin. So there can be remittances that return to their home country from working and earning in their destination country, such as in the case of South Africa. In the Americas, the migration trend tends to be quite interesting in terms of persons in North America. They are sourced from many parts around the world, and historically that has been the case. However, more recently, as in the past 3 to 4 decades, the persons that tend to migrate or seek refuge in North America primarily are derived from Latin America and the Caribbean, whereas previously the European countries seem to be the main source of migrants into North America. Because the Caribbean and Latin America is geographically close to North America, there's a lot of social and cultural connections today because of movements of persons into North America. And this movement allows for the culture to be established and for these groups to be part of minority groups and eventually maybe even become the majority groups of the North American population by virtue of the continued movements of persons in the established pathways. Some of the challenges, though, as it relates to the movements of persons from Latin America, Caribbean countries into North America, is that these persons are more predisposed to conditions that are less than optimal when compared to the native North American population. Conditions such as living conditions, health issues, where these minority groups are more adversely affected by virtue of their life expectancy, by virtue of their quality of life through morbidity consequences, and even access to healthcare services. The dynamic that encourages the movement of persons into North America from Latin American and the Caribbean countries is that these persons work and they earn and return through remittances currencies that provides favorable foreign exchange in their country of origin. So that seems to be the main reason which encourages migration and the return of remittances into their country and region of origin. The challenges, because of the inequitable access to healthcare, social support, environments for these migrant communities in North America, they have health challenges, financial challenges, social challenges. Issues such as literacy, health literacy, language difficulties are also limiting factors in terms of these individuals and community groups assimilating into the mainstream North American services. Therefore, there are barriers that these individuals have. Countries such as Haiti, Colombia, Guatemala, Venezuela have the highest risks for humanitarian crisis within their home countries, and that also serve as determinants to drive persons through migration, refugee pathways into the Americas also. Violence is not helping because people are unsafe. They are persecuted for political opinions, for social group affiliations, and this persecution reduces the safety and opportunity for persons to remain within their country of origin. Some of the practices in the Americas towards enhancing the health opportunities for refugees and migrants include services that are more inclusive and responsive to the needs of refugees and migrants themselves, where at the community level, community-based organizations, non-governmental organizations are establishing presence in these foreign-based communities, and they are attempting to deliver services, preventive medicine services, as it relates to improving the health outcomes of these particular population groups. There are also institutional arrangements to provide quality services. So not just access services, but quality of services through institutions which are responsible for delivering care to these particular population groups. There are some mechanisms also to promote financial protection for these individuals, opportunities to set up banking, opportunities to save money that's earned, and to help develop themselves and their families within their relocated environment. They're also actually part of networks and partnerships where multi-countries are getting together. Sometimes even the country of origin is providing access and opportunity for the diaspora communities in some of these destination countries. For the Eastern Mediterranean region, a lot of their refugee crisis emerged as a result of the Syrian experience, and prior to that, the Iraqi experience also. And because of movements of millions of people that have created a new social dynamic, especially in the Mediterranean, but in particular Eastern European countries as well. Some of these movements have occurred in such mass numbers that countries were not as initially geared towards receiving and responding to this type of humanitarian crisis, and have had to change some policies and practices as it relates to how best to host these refugee and migrants into their host country. What is interesting about this particular scenario as well is that the established pathways of these migrants in the Eastern Mediterranean context is creating a burden not only for the migrant and refugee populations themselves, but also for the host country and their native populations. So there is some geopolitical conflict that continues to be observed as a result of this mass movement of people. Some of the movement also occur with disease burdens and conditions. Persons from endemic regions for HIV/AIDS, for example, as they move, they're also moving with these disease burdens, already established disease burdens. So when they enter into their destination or host country, that adds on to the health burden of that particular country. The practices towards supporting some of the health challenges for these migrating population groups include promoting the right of health so that refugees and migrants are more mainstreamed into the established and existing health policies and delivery care facilities in their host country. Legal frameworks must be established so that once the legal infrastructure is established, then the delivery of programs can then follow suit towards meeting the specific demands of refugees and migrants. Also, the social determinants of migrants and refugees in the Eastern Mediterranean region, such as nutrition issues, sanitation issues, water access. These are all determinants of health of these groups that need to be catered for in terms of providing nutritious food, access to safe and clean water, as well as clean environments and housing. There is a need to monitor the health of these persons because these groups will eventually become, over generations, local populations. And as part of local population data, any health burdens to these particular groups will be overall health burdens to that local health system as well. For the European trends, the established pathways for North American refugees as well as Middle Eastern refugees into Eastern Europe and then to Western Europe have created a lot of opportunities for some of these countries in Western Europe because many of these countries are facing negative growth rate. and are unable to replace their population. So there are opportunities for these countries to receive migrants and assimilate these migrants as part of their local communities. The challenges, however, is that there are some issues with regards to the acceptance of these refugees and migrants by the native populations within the host country, and that acceptance creates difficulties in terms of assimilating into these new communities. There are cultural and social clashes and conflicts, and that creates a divide. And this divide translates into restrictions in access to healthcare, education, job opportunities as well. The practices in the European region to advocate and promote for rights, for equity, for health of refugees and migrants include dealing and attending to the determinants of the inequity to begin with, provision of short and long-term public health interventions, vaccination programs, managing monitored disease burdens in these population groups. The issue of occupational well-being, where the living conditions, the working conditions of these individuals are towards health-seeking and health-promoting practices. Enabling participation, social inclusion of these groups into mainstream society will encourage the perception and attitude of acceptance of these migrant and refugee communities in their host countries. And of course, through partnerships, cooperation, intersectoral collaboration, inter-country partnerships, then coordination mechanisms can be established in terms of how equitable, accessible, and available healthcare services are met towards the refugee and migrant groups. For the Southeast Asian region, there has been some historic migration pathways, especially in terms of forced movement. The British, for example, relocated many Asians during the colonial period in the Asian region, as well as the Dutch. The Chinese, for economic region, migrated into other countries in Southeast Asia. Today, for example, Chinese make up 14% of Thailand, 32% of Malaysia, 76% of Singapore, and as well as in Indonesia. So they have a history of migration, especially for economic reasons. This movement is encouraged as a result of the practices and experiences of these Southeast Asian region countries. There's a declaration by the Association for Southeast Asian Nations, ASEAN, and this declaration promotes for migrant inclusive health policies and job opportunities as well. The experiences have demonstrated where migrants relocate from areas of lower socioeconomic development to areas with more opportunities for socioeconomic progress. In the Western Pacific region, the trends suggest that persons of Indian origin, Chinese origin, British, Filipino, and other Asian countries, there is an interest towards relocating to some Western Pacific regions. Australia, in particular, has specific policies for immigration, skilled laborers from other parts of the Pacific region into Australia. And this has been a deliberate effort on the part of Australia to receive workers that are educated, that are skilled, to assist in the economic development of Australia. And many countries in Asia are actually engaging in this pathway as part of their migration policies as well as practices. The practices in the Asian and Western Pacific region is advocating for the free movement of workers, skilled workers in particular. The population is very dense in Asia, and there is an interest for the Asian populations to increase the diaspora and the opportunities to influence other countries in that region. So there is a Framework Act on the treatment of foreigners and the Refugee Act for Korea. The Filipinos have a Migrant Worker and Overseas Filipino Act, as Filipinos tend to export a lot of their skilled labor around the world. And in Australia, a lot of professional opportunities for immigrants to gain access to this developing country context. So this is the end of Module 2, and for Week 2, we will be discussing the practices and experiences of migrant and refugee groups. For our seminar, our discussion will include a person who coordinates, manages these refugee camps in different parts of the world, especially in some of the more prone areas of Syria, of Iraq, as well as some North African countries as well. So by the time you complete Week 2, we would have discussed distribution determinants of refugees and migrants, experiences and practices of refugees and migrants, and then we will move next into Week 3 with regards to how migrants and refugees are assimilated through the path of movement from their country of origin into their host and destination country. So a lot of exciting opportunities and engagement to look ahead to. So we will see you guys in Week 3 for Module 3. It's goodbye for now.